Hello, Siraja.
Good morning, Mom.
Now, we're going to study. Subject Gynecology. Unit 3 Infection of Female Reproductive System.
Which infectious diseases include in, Mom?
Yeah. Vaginitis. Vulvitis. Bartholin cysts and abscesses. Endometritis. Endometriosis. Salpingitis. Oophorytis.
Vaginitis.
Vaginitis is defined as the infection or inflammation of the vagina. It is one of the most frequent reasons for patient visits to the gynecologist. Causes: infections from organisms such as bacteria, viruses, fungi, yeast, etc., irritations from chemicals in cream, spray or some clothing, transmission of infection from partner, poor perineal hygiene. Common types of vaginitis: bacterial vaginitis, viral vaginitis, yeast vaginitis, chlamydia vaginitis, atopic vaginitis. Signs and symptoms: red, swollen and tender vagina, irritation and itching around genital area, burning and painful micturition with hematuria, vaginal discharge of varying degree and type. Diagnosis: detailed history, vaginal examination, high vaginal swab for culture and sensitivity. Prevention of vaginitis: 1. Dry the perineal area completely after bathing. 2. Always use clean soft cotton undergarments. 3. Always clean the perineal area from front back after a bowel movement. 4. Avoid douches and vaginal sprays. 5. Remain free from sexually transmitted disease by practicing safer sex.
Vulvitis.
Vulvitis is an inflammation of the vulva. The visible external genitalia occurs in women of all ages. It is not a disease, but refers to the inflammation of the soft folds of skin on the outside of the female genitalia, the vulva. Causes: infections are caused by germs such as bacteria, viruses and fungi. The following infections may occur causing vulvitis: genital herpes infection, genital warts, vulval cancer, allergic or contact dermatitis, irritation by chlorinated swimming pool. Symptoms: 1. Redness and swelling on labia and other parts of vulva. 2. Intense itching. 3. Clear, fluid-filled blisters. 4. Sore, thick, or white patches on vulva. 5. A burning sensation in vulvar area. Diagnosis: 1. Blood test. 2. Urine test. 3. Tests for sexually transmitted diseases. 4. Pap smear. Management: 1. Do not use products that cause irritation. 2. Use of cortisone ointment on the irritation several times a day to reduce the irritation and itching. 3. Sitz baths and the use of a topical estrogen cream. Prevention: 1. Using gentle, unscented cleaning products on the genital area, and thoroughly drying the genitals after bathing. 2. Avoid the use of douches and other fragranced feminine products. 3. Wearing breathable, loose-fitting cotton undergarments can also help prevent vulvitis, as changing into dry clothing soon after swimming and exercising.
Bartholin cysts and abscesses.
Bartholin cysts are caused when trauma or inflammation obstructs the duct of the Bartholin gland, which normally secretes mucus near the hymen ring. Epidemiology: Bartholin duct cysts, the most cystic growths in the vulva, occur in the labia majora. 2% of women develop a Bartholin's duct cysts or gland abscess at some time in life. Treatment: 1. The treatment of a Bartholin's duct cyst depends on the patient's symptoms. An asymptomatic cyst may require no treatment, but symptomatic Bartholin's duct cysts and gland abscesses require drainage. 2. Although incision and drainage is a relatively quick and easy procedure that provides almost immediate relief to the patient, this approach should be discouraged because there is a tendency for the cyst or abscess to recur. In most cases, Abscess cultures are obtained, and screening for sexually transmitted diseases and treat accordingly. 3. Vulvar mass in a postmenopausal woman can be cancer. Excision biopsy may be required. 4. Sitz baths taken 2 or 3 times daily may aid patient comfort and healing during the immediate post-operative period. Coitus may be resumed after catheter insertion.
Endometritis.
Endometritis is an inflammatory condition of the lining of the uterus, and it's usually due to an infection. Causes: 1. Sexually transmitted infections, STIs, such as chlamydia and gonorrhea. 2. Tuberculosis. 3. Infections resulting from the 2-3 vaginal bacteria. Risk factors: 1. Infection can cause endometritis after a miscarriage or after childbirth, especially following a long labor or a cesarean delivery. 2. Medical procedures that can increase your risk of developing endometritis include hysteroscopy, placement of an intrauterine device, UD. Signs and symptoms: 1. Elevated fever to 104 degrees Fahrenheit. 2. Tachycardia. 3. Chills with severe infection. 4. Uterine tenderness. 5. Pelvic pain. 6. Subrevolution. Diagnosis: 1. Vaginal swab culture to identify the STI infection-causing bacteria of gonorrhea. 2. Blood and urine culture. 3. CBC, WBC and Acer counting. 4. Endometrial biopsy. 5. CT scan of the abdomen. Complications: 1. Salpingitis. 2. Peritonitis. 3. Infertility. 4. Septicemia. 5. Septic shock. Treatment: 1. Broad-spectrum antibiotics. 2. The combination of clindamycin and gentamicin may also be used, as may metronidazole if the mother is not breastfeeding. 3. Mod endometritis can be treated with oral therapy, although more serious infection require hospitalization for IV therapy.
Endometriosis.
Endometriosis is the presence of endometrial tissue outside of the uterine cavity. Causes: the cause of endometriosis is unknown. However, the presence of endometriosis is rare before menarche and after menopause and is most common diagnosed between the ages 22-30. Symptoms of endometriosis: 1. Pelvic pain. 2. Dyspareunia. 3. Infertility. 3. Depression or anxiety. 4. Nausea. 5. Having bleeding during period and bleeding period. Diagnosis: 1. Physical examination. 2. Laparoscopy. 3. Biopsy. 4. MRI.
Salpingitis.
Salpingitis is an acute inflammation of the fallopian tube, most commonly caused by sexually transmitted microorganisms due to chlamydia and gonorrhea in adolescent and adult women. Types of salpingitis: 1. Acute salpingitis. 2. Chronic salpingitis. Etiology: 1. Also herpes and CMV, fungi, parasites. 2. 30-40% are polymicrobial. 3. 10-20% of untreated chlamydia or gonorrhea infection progress to PID. 4. Mostly reported sexually transmitted diseases associated with PID. Signs and symptoms: 1. Abnormal vaginal discharge, such as unusual color or smell. 2. Dysmenorrhea. 3. Pain during ovulation. 4. Uncomfortable or painful sexual intercourse. 5. Fever greater than 101 degrees Fahrenheit. 6. Lower back pain. 7. Frequent urination. 8. Nausea and vomiting. 9. Lower abdominal pain. 10. Symptoms usually appear after the menstrual period. Diagnosis: 1. General examination. 2. Pelvic examination. 3. Blood test. 4. Blood and urine culture. 5. Vaginal or cervical swab. 6. Laparoscopy. Ascending infection may occur through 1. Sexual intercourse. 2. Abortion. 3. Miscarriage. 4. Childbirth. 5. Insertion of a nude. 6. Appendicitis. Treatment. The treatment of acute salpingitis depends upon 1. Early diagnosis. 2. Hospitalization and bed rest. 3. The use of antibiotic therapy that takes into account the polymicrobial etiology of acute salpingitis. 4. Prevention of recurrent episodes of salpingitis through efforts at patient education and identification and treatment of sexual partners.
Oophoritis.
Oophoritis term refers to inflammatory condition of single or pair of ovaries. The bacteria are usually introduced to the reproductive organs through sexually transmitted infections like gonorrhea and chlamydia. Etiology. 1. Usually resent sexual intercourse. 2. Insertion of a nude. 3. Recent childbirth or abortion. Symptoms. Acute oophoritis symptoms. 1. Severe lower abdominal pain. 2. High fever and chills. 3. Vomiting. Chronic oophoritis symptoms. 1. Fever. 2. Abdominal pain. 3. Lower back pain. 4. Malaise. Diagnosis. 1. History and physical examination. 2. Pelvic examination. 3. Pelvic ultrasound. 4. Culture test for vaginal discharge. 5. Laparoscopic examination. Complications. Ectopic pregnancy. Treatment. 1. Initially, patient is treated with antibiotic therapy to stop the microbial growth. 2. For symptomatic relief, application of hot pad at the lower abdomen. This may help to reduction of pain. 3. Warm bath is also recommended for 2-3 times a day for 10-15 minutes for reduction of the symptoms. 4. Trier sexually transmitted infection for gonorrhea and chlamydia infection. 5. Pain relief with NSAIDs. 6. Avoidance of sexual activity till the infection subsides. Thank you to visit my session.